Oral Health and Skeletal System Integrity, a 2025 Perspective Abstract. Mounting evidence reinforces a significant association between oral diseases such as periodontitis and dental caries and skeletal system health, particularly osteoporosis, bone mineral density (BMD), and fracture risk. Mechanistic links include systemic inflammation, oral bone marrow signaling, oxidative stress, and microbiome-driven pathways. This article synthesizes key findings from 2025 and earlier integrative studies, with implications for prevention and clinical integration. 1. Observational evidence, periodontitis, caries, and osteoporosis. A comprehensive meta-analysis of 28 observational studies involving nearly 20,000 postmenopausal women showed that those with osteoporosis had significantly worse periodontal health, greater clinical attachment loss. Reddit 3 Biomed Central 3DR bicuspid.com 3 PubMed. A longitudinal Korean cohort 10-19-4000 10 years follow-up found that periodontitis R1, 09, 15 missing teeth R1, 59, and 6 decayed teeth R1. 17 were linked to higher osteoporotic fracture risk. Conversely, frequent tooth brushing 3 times or day RO 82 and recent dental scaling RO 87 were associated with reduced fracture incidence. BMC1 Frontiers 1-2 Causal Insights, Dental Caries and Skeletal Fragility. A 2025 Mendelian randomization MR study offered causal evidence. Dental caries DMFS index had a positive causal effect on osteoporosis, low BMD, and pathological fracture risk, especially in postmenopausal populations. Interestingly, periodontitis did not show a direct causal effect in MR analysis, despite observational associations. Biomed Central 1DR bicuspid.com 1-3 Additional cohort and risk analysis findings. A 5-year prospective study in elderly women 65 years found untreated or recently treated osteoporosis yielded a 4 increase in tooth loss due to periodontitis RR4 and higher FRAX scores predicted greater tooth loss risk RR1. 25 Reddit 8 PubMed 8 PMC 8 evidence also shows patients with periodontitis and osteoporosis share risk factors: age, estrogen deficiency, inflammation, and that untreated skeletal fragility may worsen alveolar bone resorption. Springer open for mechanistic pathways linking oral health and skeletal bone loss, say inflammatory mediators and bone remodeling. Chronic periodontal inflammation elevates systemic cytokines IL-6, TNF, CARP that enhance osteoclast activity while suppressing osteoblasts. This shifts the rank or rank-alobgy balance toward bone resorption, affecting both alveolar and skeletal bone frontiers. B. Oxidative stress. Postmenopausal estrogen deficiency and chronic periodontal inflammation both promote oxidative stress, triggering osteoblastic apoptosis and accelerating bone loss systemically and locally. Reddit 9 Frontiers 9 Reddit 9C Oral 2 Bone marrow crosstalk. Oral dysbiosis and dental caries may induce systemic IL-6 elevation and expansion of osteoclast precursor cells in bone marrow. These precursors migrate to skeletal sites, amplifying bone resorption even in distant sites. Biomed Central D. Shared risk factors and bidirectional exacerbation. Osteoporosis and periodontitis share demographic, hormonal, and lifestyle risk factors, for example, advanced age, low BMI, menopause. Each condition may exacerbate the other via systemic inflammation and bone fragility. Springer Open Biomed Central 5 Nutritional and pharmacologic modulating effects. Reductions in systemic inflammation, including statin therapy, for example, atorvastatin 80 mg, have been reported to reduce periodontal inflammation and potentially support bone formation, suggesting adjunctive systemic therapy may benefit both oral and skeletal health. Reddit 1. Furthermore, Mediterranean-style diets high in anti-inflammatory monounsaturated fat oleic acid have been shown in animal models to guard systemic bone microarchitecture against alveolar inflammation induced by P. gingivalis, supporting nutritional interventions for bone resilience. Reddit 6 Clinical and public health implications. Dual screening opportunity. Patients with severe periodontal disease, missing teeth, or dental caries, especially postmenopausal women, may warrant bone density screening or fracture risk assessment. Oral hygiene as preventive. Encouraging frequent brushing, flossing, and annual dental cleanings may curb both oral inflammation and systemic bone loss. Interdisciplinary care, collaboration between dentists, primary care, endocrinologists, and geriatric specialists could help identify individuals at higher risk and implement integrated prevention strategies. Therapeutic potential, targeting inflammation via periodontal treatment or adjunctive therapies, for example statins, antioxidants, Nutrition may benefit bone health beyond the oral cavity. 7. Research gaps and future directions. Conduct interventional trials to test whether periodontal therapy or caries management reduces long-term fracture risk or improves systemic BMD. Investigate longitudinal oral bone marrow signaling, particularly the role of oral pathobionts-induced cytokines and osteoclast precursor migration. Clarify why dental caries but not periodontitis may show a stronger causal link to osteoporosis via MR methods. Explore targeted therapies combining periodontal care, anti-inflammatory nutrition, and pharmacological bone-preserving interventions. Conclusion: the growing body of evidence through 2025 underscores a significant oral skeletal axis. Poor oral health, including periodontitis and dental caries, is associated with diminished bone mineral density, increased risk of osteoporosis, and higher fracture incidence. Key mechanisms involve systemic inflammation, oxidative stress, oral microbial impacts on bone marrow, and shared lifestyle and hormonal risk factors. Interdisciplinary prevention, early screening, and integrated care strategies may help to mitigate skeletal fragility and oral disease progression. References: Park G. H. Edel. Better oral hygiene associated with reduced osteoporotic fracture risk. Nationwide cohort study. Front Endocrinol Lausanne 2023. 14 to 1,253,903 Biomed Central PMC 1 Frontiers 1 Meta-analysis, Periodontal Disease and Postmenopausal Osteoporosis, PubMed 2023 Reddit 15 PubMed 15 Frontiers 15 BMC Oral Health 2025 MR Analysis Dental Caries Causally Linked to Osteoporosis or Fractures Biomed Central 1 DR Bicuspid.com. Prospective study, untreated osteoporosis increases tooth loss risk 5-year follow-up PubMed cohort data. Periodontitis increases osteoporosis risk in women HR1. 22 Biomed Central Osteometabolic Periodontitis Position. Anti-resorptive therapy and inflammation impacts Springer Open Oxidative Stress Influence on Periodontitis. And Osteoporosis Pathogenesis Frontiers Wiley Online Library. Nutritional immunometabolic data, OAVS pod diets impact bone resilience after P. gingivalis infection, Reddit reports, statins reducing periodontal inflammation and supporting bone restoration, Reddit.